Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf. Today, we're going to talk about an anxiety, that feeling in the pit of your stomach when you're worried or uncomfortable, which basically happens to all of us at one point or another, like when you're getting ready for a test or an interview. But when does an anxiety become an issue that requires interference, and when should you seek help? This is what we'll learn today from Dr. Simon Rubidge, a psychiatrist with the American Center for Psychiatry and Neurology. Dr. Simon has more than 20 years of experience treating individuals by using a holistic and evidence-based approach to treating psychiatric disorders, which include both pharmacological and non-pharmacological interventions. Welcome, Dr. Simon. Thank you for being with us today.
Thank you, Yasmin, and thank you for the invitation. It's a pleasure to be here.
My pleasure. So can you tell us more about your approach? Why do you use pharmacological and non-pharmacological methods?
Well, I suppose the idea would be that people develop their own skills, their own coping mechanisms to manage anxiety. So that would be the non-pharmacological approach. But sometimes they need the help and the assistance of medication. So medication is there to assist people to get better and to cope and to manage their anxiety rather than the primary treatment. So as you mentioned in your introduction, everybody experiences anxiety. It's one of the few disorders that people experience that we've all had that experience of anxiety. Maybe not to a disorder level, but certainly have had the understanding of what anxiety is. So it's just learning to manage anxiety so that we have a more comfortable life and that it doesn't become a disorder, which is when we need to then treat it.
Okay, that's actually good because a lot of psychiatrists just go for medication and then, okay, we'll go for that on a month or 2 months and then we'll see what happens. So
I'm not sure that a lot of psychiatry does have
a lot of experience.
Psychiatry does have that reputation that psychiatrists do have that experience, that reputation of prescribing medication first. And for me personally, as I mentioned, I try to tend to not reserve it, but I try to look for other ways of managing things before medication, which is not to say that medication is not good and important, okay? I need to emphasize that. I just tend to be a little bit more conservative when it comes to treating people.
No, both my parents are doctors, so I'm comfortable with medication. It's okay.
We'll talk about that, hopefully.
Okay. So what are the most common symptoms of anxiety?
I think it's important that we realize that anxiety is an important part of life. We need to have anxiety. Without anxiety, we won't achieve things. We won't prepare for things. We won't see the risk or dangers that are either there or that will be there in the future. So it's important to recognize that we do need a certain amount of anxiety. If your anxiety becomes too high, then it becomes a disorder and it causes distress to you, or it interferes with your social or occupational functioning. Then we need to treat that disorder, and then it becomes a problem. But you do need to be able to have some anxiety to actually motivate you and to prepare you and to either prepare you to avoid danger or to get out of danger. So it depends where we are on the scale of anxiety. So often people will have that pit of the stomach kind of fear and nervousness before an exam or before an oral or whatever it might be, presentation. But then you can also get the extreme where you have panic attacks. So symptoms really do depend on what the underlying anxiety disorder is. Okay? So we have anxiety that is day-to-day anxiety. But then you can start getting into the disorders like generalized anxiety disorder. You can have specific phobias. You can have panic attacks. There are a multitude of anxiety disorders. And then they will present with different symptoms. And people will present with different symptoms. So typically people will have, if we start off at the top, let's talk about thoughts. People will have recurrent thoughts of something bad's going to happen. This is going to hurt me. This is going to distress me. Then they can have the feelings of anxiety, the fear, the panic, the sense that there is some impending danger. And then you get the more physical manifestations, which will be rapid heart rate, palpitations, which is the physical sensation of a heartbeat. You will get difficulty breathing, choking sensation, or you will start hyperventilating. People can get gastric upset. And I've got actually quite an interesting story that I might be able to relay a little bit later on. But people can get gastric upsets, can have diarrhea. This one person that I might mention will be, it's particularly their anxiety is vomiting. Okay. And then you can get sweating, trembling. And then if the anxiety is bad enough and persistent, it can start interfering with your sleep, can start interfering with your mood, you can become irritable. It can actually lead, chronic anxiety can even lead to a form of depression as well. So it's a multitude, and some people present with those symptoms and some people will present with other symptoms, and the intensity varies from patient to patient as well.
So there's like a spectrum. It's not like you either have an anxiety or you don't. There's just depends on where on scale of 1 to 10 you are.
The whole of human existence is a spectrum. Okay. No, true. You get short people, you get tall people, and they get people in the middle. Okay. Thin people, overweight people, people in the middle. You get people who run very slowly, and you get people who run very fast, and then you get the masses in the middle. And it's a Gaussian distribution. Okay, so the majority are here with outliers on either side. So everything, I think, is a spectrum.
That's interesting and makes a lot of sense, actually.
So, yeah.
Okay, so what are some coping mechanisms that you usually advise for anxiety?
So once again, depending on what the presentation is, general coping mechanisms are, firstly, you need to try and understand, and if we're not talking disorder, if we're just talking about people who are experiencing day-to-day anxiety, but it's not at the threshold of a disorder where they are seeking medical help or professional help, then it is good to try and identify the cause, because the cause of anxiety is quite interesting, because anxiety can be caused either by exogenous factors, so factors like financial stress, okay, or an operational health issues, but then they can also be caused by what we call endogenous. This is a little bit old-fashioned, but I still think it works. Endogenous, which is a product of your own brain, creating anxiety, which may or may not really be there. Okay, so you need to identify the source of your anxiety. So if you can identify that the source of your anxiety is a horrible boss who's treating you badly, then either you speak to the boss and address that, or you look for a new job, okay? And try and take away the source of your anxiety. So try and get away the trigger. But if you are just experiencing day-to-day anxiety, as we all do from time to time, or in our busy lives, lots of strategies we can use. So for me, probably the most important strategy, and I try and encourage in all my patients, is to become physically active. There's quite a lot of evidence to suggest that, or there's new evidence to suggest more about depression rather than anxiety, but I think the two are very closely linked anyway, is exercise. Regular exercise, which is 30 minutes a day of not vigorous, moderate exercise. So a good brisk walk for 30 minutes, 5 times a week, so about 150 minutes, okay, is a good form, a good coping strategy. And if you can start getting fitter, whether it be through strength, going to the gym for strength exercise, or whether it's getting cardiovascularly fit, in other words, just being able to do more
running,
absolutely,
cycling.
Then that improvement in physical fitness actually leads to an improvement in mental health. Okay, it actually can be a form of treatment for depression. Obviously, when you're depressed, it's very difficult to get you motivated. But so for me, physical exercise is imperative. Okay. Then you've got things such as mindfulness and meditation. I suppose you've heard about that.
Yeah.
Do you know what it is? Because
we're a well-being podcast.
Right,
so yeah.
So mindfulness. So what is meditation? What is mindfulness? Well, it's really trying to be in the moment. It's trying to stop the noise in your head, to try and focus in the here and now, so that you, just by being here, which is in itself not an anxiety provoking, you reduce your anxiety, and it gives you perspective, as opposed to projecting about the future, which may be a source of your anxiety. So, and meditation can involve just watching your thoughts and not putting any valence on them. In other words, not adding any emotional content. They're neither good nor bad. Meditating and just watching your thoughts, so that you are just an observer, really, to give you perspective. And then you can do visualizations, so that's quite good. Yoga is another form of meditation. Breathing exercises. That's good, because if you can if you are slightly hyperventilating, if you can control your breathing, then you will reduce your anxiety. Obviously, avoiding
triggers.
Yes, so bad things. Caffeine, up to a point, caffeine. I think if you're going to have 20 cups of coffee,
everybody would be anxious then.
Right, correct. So avoiding stimulants that may lead to it, if you can identify what they are. Alcohol is a big cause of anxiety. So excess alcohol, it's fine as the levels build up, but the following day can actually lead to panic, can actually induce panic disorder and cause anxiety. So lifestyle choices, good sleep patterns, important. People do talk to me about a magical figure of 7.5 hours or 8 hours. I don't agree with that. Okay, I know, and this is obviously my opinion. This is not necessarily based on a very intense study, but there are people who have functioned on 3.5 hours sleep a day. Okay, but it suits their body. They don't set their alarms. They just sleep for 3.5 hours.
Yeah.
They then function perfectly through the rest of the day. Okay. There's some people who need 10 hours sleep. I had a colleague who told me if he does not get 10 hours sleep a day, he cannot function properly. Now, once again, there's a spectrum, and it's somewhere in between. Okay. Yeah. But trying to get a good sleep pattern is obviously important. I think diet, I've mentioned, trying to everything, in balance, but trying to get avoiding
healthy
the
choices,
processed carbs, and I can talk to you about that for half an hour if you want. But yeah, just good diet. And then I suppose getting, very importantly, the absence of anxiety or of depression is not just, or the treatment, a good life is not just the absence of anxiety or depression. You also need to be happy. You need to enjoy things. You need to be doing things that actually give you pleasure, okay? And it's quite important, and whether that be spiritual, physical, emotional, making sure you've got a good support network, good friendship circle, identifying what is important to you and trying to follow those things. Those are all good ways of managing anxiety.
It's very refreshing to hear psychiatrists recommend meditation and yoga and things like that, because there is that stereotype that there is people who go for wellness or well-being, and then there is the psychiatrists who only go for medication. So to find that, no, I mean, you've chosen to be a psychiatrist, but you also understand the importance of things like medication. This is very refreshing.
All right. Well, I'm glad you think so. But I will have to just say a little bit in defence. There is a group of psychiatrists who question. We don't question the role of medication, but we try and look at the bigger picture. So it's not unique to me. There is a trend, I think, also, and I've been in psychiatry for 20 years, okay, and I've seen what medication can do and its limitations. So possibly when I was younger, I was quick with the medication. Absolutely. And as I've got older, you realize, I think,
there's a deeper level.
Let's not say older. As I've matured and got experience, we'll say there is a different level, not necessarily deep, but a different way of dealing with things. So I think it is important. I think it is important to look at those aspects, because they really do make a difference.
Yeah, I agree. I mean,
And of course, I didn't mention talking therapy. Talking therapy, of course, is a way of managing anxiety. You are then starting to get into the disorders, but certainly sharing your problems, sharing your anxieties, discussing it can be a way of managing anxiety.
Okay, so just to clarify and to make sure that everybody understands this, what is an anxiety disorder and what is just day-to-day anxiety?
It's your threshold. Okay, so if you, as I said to you, you have to have anxiety.
Yeah.
Okay, so it's what saved us from the lions when we were
Fight or flight.
Absolutely, you need to have that. Component. But when it starts interfering in your personal life, in other words, it causes you distress. Okay, it affects your sleep. It makes life unpleasant. You're so worried that you just can't enjoy the things that you should be enjoying. Okay, then absolutely, that's a threshold for going into disorder. Okay, if it starts interfering with your occupation, you don't want to go to work, or you dread going to work, or you don't want to go to school, or even social circles. People have social phobia or whatever. They don't want to go into work. They don't want to be with friends. That then is becoming problematic, and then it becomes a disorder. So a disorder is really just is a way of trying to define an illness. And obviously, we don't have any direct tests. We have rating scales, and it's all about threshold, really. When it becomes so unpleasant that you need to do something about it from a medical sort of a professional aspect. Yes. And obviously, you don't need to be completely in a disorder point of view. You can go and get help online. There's online help. You can, you can speak to a therapist without having to necessarily be into a severe state or disorder. But it's really about the threshold and when it starts becoming unpleasant.
Okay.
Some people, unfortunately, have that from quite a young age. And I'm an adult psychiatrist. I don't treat people who are under 18. So some people have anxiety from a very young age. Some people develop anxiety. And once again, it just depends what the cause is and the underlying mechanism and the type.
So is anxiety genetic? Is it something that you're sort of born with, or it's just in your DNA, or does it only happen as a result of a certain experience or trauma?
So I think a lot of anxiety is genetic. Okay. And I will get into a lot of trouble if any of my psychology colleagues or even of my colleagues look at this, because there's a huge component now of this trauma-based mental health. In other words, trauma is the trigger for everything. I'm not saying it isn't. Trauma can absolutely be the trigger for things. But one has to, but I do believe that genetics play an important role. So once again, you will have people who are born, and they are born being slightly sensitive, okay? They are born just being more risk averse, more aware of the dangers, and that is genetic. So they are just more sensitive. Once again, we're back on the spectrum, okay? Yeah. So you get people like Donald Trump, and I don't know if we can say that, okay, who seem to have very little, and I don't know how, you get people who have very little anxiety and who just seem to be able to deal with things, okay, easily, and then you got people who are very sensitive. The problem with a very sensitive person is they will be sensitive from the day they can be aware. Yeah. So if someone criticized them at the age of 5 and they're sensitive, that will become that person was critical. So then you will almost absorb that into that trauma caused me to be anxious. Well, I think probably your sensitivity allowed you to sort of focus on that, and then that became the focus of why you think you're anxious. But actually, you've probably been anxious your whole time, and then you will filter all the criticisms, or the hurts, or the traumas. And I think very importantly, just to get back to the trauma-based, I've come from South Africa, I've lived in the UK, I'm now living in the UAE. I think one person's trauma is not another person's trauma.
Yes.
So then I start looking at people, where they've never had an inside toilet or running water. Now, is that more traumatic than someone who got scolded by their parents? So we have to decide what trauma is. I'm a little bit I don't want to see people saying, oh, I had this traumatic event, therefore I'm now defined by this, and as a consequence, I behave like this and I almost can't change it. Okay. We've all been exposed to traumas, and it's how you deal with it here going forward rather than, in my opinion, looking back. And that's not to take away from absolute trauma that's happened, abuse, sexual abuse, verbal abuse, physical abuse. That really is trauma. And that one, either works or accepts that it's there and then moves on to try to deal with the here and now and deal with current symptoms.
Okay. From your experience, I know it's different cultures and different backgrounds, but would you say that there are some people who are more prone to an anxiety, like a certain gender or age or just something?
No, I can't. I can't say that. I've not identified a specific group. So I've seen young people, older people. I've seen male, female. It's really, for me, I can't identify, other than there are some people who are just by nature more sensitive, high rejection sensitivity, which is that awareness of, did I upset them? People pleasing, don't want to say no to them, don't want to be doing the wrong thing, don't want to insult people on a post or something like that. They're just very sensitive to others' feelings. And I think they probably are more prone to certain types, maybe generalized anxiety as well. But things like panic disorder, which can happen to anyone and any age, I think that is just luck of the draw, and sometimes people get diabetes and some people get panic disorder.
Okay. Have you noticed that an anxiety is becoming more common in younger generations? Or is it that in the past we just simply weren't aware of it, so we just didn't know how to identify it, but now that we have the awareness, we are saying that it's more common when it was just the same?
Once again, this is anecdotal, okay? This is not based. It's very difficult to base it on research, because if you've never done the research before and you do it now, you don't have anything to compare it to. I think anxiety has been around forever. You know, if you were living many centuries ago, you would be having to fight disease, you would be having to fight wildlife, getting clean water, absolutely, marauding tribes. So then you would have high levels of anxiety, okay? If you were in World War II, I'm sure there were very high levels of anxiety.
PTSD.
Correct. So I think it's always been around. I think it is the awareness, okay? And we can talk a little bit about the pros and cons of that. But certainly I think it's always been around. I think we're much more aware of it now, which is both a good thing and a bad thing. Or rather, not a good thing and a bad thing, which, as I say, could be either positive or negative. So I think it's probably always been around, and I'm not sure that there's an absolute increase. Having said that, when you have things like the threat of global warming and global extinction, I think that causes pervasive anxiety. I think if you look at just the way that certain societies dealt with the COVID pandemic and the restrictions placed and the messages that were sent out, if you don't do this, if you don't do that, you will kill grandmother, etc. I think that causes anxiety. So I think there are certain societal things that may be leading to this increased anxiety, and I think probably that's happening more to our teens and our young people, because as you get older, well, A, you sort of know you've got a limited lifespan, okay, and B, you've had other life experience. But if you are faced with, let's just talk about the global warming and this, and often the message is, if you don't do this, then there will be this catastrophe. Yeah. That's quite fear-invoking, but for all ages, actually, not just for the youngsters. So that's the one aspect. The other aspect is mobile phones. I think mobile phones are fantastic, brilliant, give us freedom, allow us to get information. The problem comes in when you can bring that mobile phone into your house 24/7. So you can get onto you can be get onto a thread or a theme, and then become very involved in that, bring it into your bedroom, and that 24/7, that new information, getting all of it, and depending on what you've filtered and what you've chosen, that I think is anxiety provoking. And I think we need to be more, and I think we will become more aware of the impact of mobile phones and that information and the effect it has on us.
Information overload.
I think so. And also, you get cyberbullying amongst youngsters. Well, actually, trolling, exactly. So, and it can be, for me, this information, having access to this information 24/7, for some people. Of course, other people are very good at putting the phone aside, but some people live in it. Yeah. And also, I think then social media, depending, can cause can lead to some anxieties, as I've mentioned. So it's really, I think the mobile phone is problematic and probably leading to more anxiety, I think.
I think it goes back to what you said, that balance is key. So I don't think anything is absolutely good or absolutely bad. It just depends on how you use it and when you use it. If you're able to put some limitations to yourself, then mobile phones are good. If you're just all the time on your phone, then mobile phones are bad.
And, yes. And I think the youngsters probably are on their phone.
Yeah. Yeah, they were born with it, so it's hard for them.
Didn't have that, so there you go. Difficult to know.
Yeah. Going back to something you said, and I'll use COVID as an example, wouldn't you say that other generations also faced pandemics? And as pandemics go, COVID was one of the lighter ones. We've actually had, we have a lot of facilities now that weren't there at the time of the plague, for example. So.
Yes, absolutely. But you didn't know what was happening in Spain when you were in South Africa. Yeah, okay, so you didn't, and that's really what I'm saying. So if someone gets shot in America, that can be, that's happening on your phone right here with you, and it's as if you are there. So yes, in the society that you were in, if Spanish flu was running through your family and your community, absolutely you would be anxious. But outside of that,
we didn't know.
We didn't know.
Yeah.
Or we may be less aware. Okay. And then also, I suppose, belief structures. What is, if we do know that people with a more sort of stronger spiritual belief can actually fare better than people without that. Okay, because they've got something to, they've got a focus, they've got a structure, they've got something that gives them support and encouragement. If you are a Buddhist and you believe in reincarnation, then you will work harder to do the right thing here, and you will believe that it's worth, so you come back something good. So I think that's gone off the topic slightly, but yes, I think that all impacts on us. You mentioned COVID restrictions, but the messaging though also during the COVID pandemic and the restrictions was danger, wasn't it? So we didn't have that in Spain. We didn't have it in Spain. We didn't have it during the pandemic. We didn't have that. You would get messages in fear, but...
What do you think of the research that suggests that Gen Z are the most depressed or most anxious generation?
I want to know why you want to know that, actually.
I'm just very curious. I'm a millennial myself, but I do see Gen Z are very... Like when I was their age, I was living a much simpler life. So is it the awareness or is it more than that?
I don't think there's clear evidence that there's certainly a higher incidence, but we're back to that awareness versus, are we more aware of it, therefore we are identifying more episodes. I'm not sure, we don't know yet for sure in the little bit of research that I've done that there is a definite increase. Okay. But for the reasons that we mentioned, there may be, the fact that that they have all this exposure to all this information, this connectivity to people can be positive, but it can lead to the negative, to to the trawling, to the cyberbullying, etc. Bringing all that information may be something, because they're on their phones, they're glued to their phones, aren't they? So maybe that does give rise to increased anxiety. There's also theories about, financial pressure, the need to study. Everybody's going to study at university. I think it's very important that we, if you can, trust your brain to lead you in the right direction. Not everybody can go to university or should go to universities to study. Some people should be doing a trade because they're good with their hands. But we know that people do tend to go to university more because there's the perception or reality that you will achieve more.
Yeah.
Okay, so once again, there may be more pressure on Gen Z, but we have to remember, I mean, I've got children that fall into that category. So I know people around that category. I would be seeing people from the Gen Z, and I don't see it. I don't see a big increase in 22-year-olds coming knocking on my door saying I'm, anxious. There's a lot more support in some ways.
Yeah.
There's a lot more awareness. They seem to have a different approach to life. There is this idea that the work balance is possibly better. I don't know. We also don't want to say that we have to be protected from the harshness of life. Life is hard. Life is difficult. At the end of it, ultimately, you die. So it's quite a sorrowful ending. But
depends. If you're a Buddhist, it's not.
Well, there you go. So I've lost my train of thought. So it is hard. It is meant to be difficult. And whether it's harder now or then, I don't know. It was I think it was a simpler life, but that doesn't mean to say you didn't get into groups that were nasty or horrible or excluded from a group, and that there wasn't bullying. There was. But we certainly weren't as materialistic, and we certainly weren't probably as individualistic. I think this being aware of what other people are achieving, what they are doing, I think that can be problematic, because we're comparing ourselves the whole time, and you see it. And you know how much this one's earning, you know what sort of followers this one has, and so the pressures are slightly different to achieve. But there are a lot of Gen Zs who are doing fine.
Yeah, of course. I mean, that's not to say that the whole generation is depressed.
I'm not sure that we should be even looking at that. I think what we should be saying is, yes, let's look at mental health. What can we do to improve, to create resilience? Because that's another big thing, is so that you are resilient. You develop resilience to become, to deal with life stresses and strains.
Because they're always going to be there. So
correct. No.
If someone does succeed in inventing a time machine, then we can go back and see
it would be
who had harsher conditions and compare.
It would be very interesting. So yeah.
Okay. How can friends and family support someone who has an anxiety disorder?
I think we must all remember we are not therapists. The family members are not therapists. And what I mean by that is you're there to be supportive, but you can't manage or try and treat their anxiety disorder. In other words, sometimes it's good just to be listening, to be there with them, to say, yes, I can see you struggling, and then to help them find the resources they need to find their own solution, because it should be about them finding their own solutions. But really, it is about allowing people. I had a patient who I saw fairly recently, who I think is probably has one of the more severe depressions that I've seen since being in the UAE. I've been here 9 months, and this person will not inform anybody else of their condition. They cannot approach family. They cannot approach the work. They are profoundly unwell. They should not be working, but they do not feel they can reach out to anyone because of the stigma and the fact that they will be seen as weak. So if we can just accept, encourage, and then help them to seek the help, to seek the help they need, I think. I don't know if you were looking for anything more specifically than that.
Just whatever your experience.
But really, it is about allowing them to find their path. And also sometimes, often if it's the younger generation, you need to provide them with the structure, the reassurances that can help treat people depending on the anxiety. So it really all depends on what type of anxiety you have and what. I don't think we've covered that but a lot of the different types of anxiety, but maybe that's not for today anyway.
No, if there are different types of anxiety, please tell us. I thought it was just a spectrum, but...
No, I mean, you've got different types of anxiety disorders.
Okay.
Okay, so for instance, the ones that we see most commonly are going to be your generalized anxiety disorder, your panic disorder, okay, panic attacks, and then your specific phobias. Okay, those are probably the three most common parts, disorders. Generalized anxiety disorder is exactly what it says. It's being anxious about day-to-day things. Okay, so whether it's health, family's health, finances, work, social, friends, it's just everything makes them worried. Everything is anxiety-provoking. They will predict worst case outcomes. Okay, and that affects day to day. They feel on edge 24/7. They feel stressed. They have the symptoms of anxiety for most days, and it's just there all the time. But it's not a specific thing. It'll shift from one thing to another. Okay, so that's generalized anxiety. Then you get panic disorders, which often are triggered by an event, say a near-death experience. You're driving along and you have a severe car crash. That may then trigger future panic attacks in that situation or whenever. So that's panic disorder, and those are discrete episodes of anxiety. So in between, you could be completely fine, and then you could be sitting on a beach and suddenly get a panic attack. Okay, it does depend then on what the anxieties, on the treatment you seek for those various types. Okay, so generalized anxiety would be far more the sort of holistic approach, the lifestyle choices, the coping mechanisms, etc. Panic disorder would be, for me, much more, please attend your professional and get help.
Get help.
People do obviously recover from panic without it, but that specifically. And then depending on how, like the specific phobias, depending on how how anxious it makes you, you could seek help for that as well.
So not everybody who has an anxiety gets panic attacks, because that's a common misconception.
No, not at all.
Okay.
Not at all. So, I mean, they do overlap, and there is a huge overlap, so sometimes it's not that easy. There's a big association between depression and anxiety.
Yeah.
So people who are depressed will often have anxiety. Anxiety can almost be this genetic personality trait, but no, there are discrete, distinct disorders. OCD used to be considered part of the anxiety disorders. It's separate now in terms of our diagnostic, our way of diagnosing disorders. It is separate now from the other anxiety disorders, but obviously it's associated with anxiety, but that's a very specific disorder that needs specific treatment if it reaches, if it interferes with your life. I'm just trying to think if there was another disorder that falls out of that. No, not that I can think of now. Then you have the childhood, like selective mutisms, the separation anxieties, but that's for the children. As I say, I don't deal with that. ADHD.
That falls under anxiety? I didn't know.
No, it doesn't.
Okay.
Absolutely doesn't. Please don't. Right. But
it does not.
There's a lot of anxiety associated. Now, it's quite interesting as I've seen things progress. I mean, ADHD has become this all-pervasive diagnosis.
Yeah.
Everybody struggles with concentration at some time or another. But it's often difficult to separate ADHD from an anxiety disorder. And interestingly, people who get treated with ADHD medication can sometimes improve their anxiety. So they actually, even though the medication can cause anxiety, being on treatment can actually reduce your anxiety.
Okay. Very interesting.
So it is interesting because I'm quite categorical, used to be, and you say, oh, this is ADHD, this is anxiety, but now there is just an overlap. It is a spectrum. Even the disorders are spectrums. So schizophrenia, bipolar mood disorders, sometimes they look very similar, and then, or not look similar. Sometimes it's hard to differentiate between schizophrenia and bipolar. There's also a diagnostic category of schizoaffective disorder. So once again, on the spectrum. Not sure if that's going to fit into what we're talking about.
We can talk about anything you want to talk about.
Good. Yes.
Okay. My last question, just because we're out of time, but I would actually have loved to continue this conversation, but we need to cut it short. How can you deal with someone who's having a panic attack? And I've been in that situation myself, so this is a question for me, really.
All right. Well, the most important thing is to know they're having a panic attack.
Okay.
So 50% of people who present at your casualty or emergency room with a heart attack are actually having a panic attack. Okay. But you can only diagnose a panic attack once you've excluded a medical cause for their condition. Okay. Generally speaking. Okay. And then really it would be about reassuring, controlling the breathing, because with panic disorder, with panic attacks, you often have hyperventilation. Okay, so if you can control someone's breathing, either by getting them to have slowly inhale and slowly exhale, or use the paper bag if they're hyperventilating, if you can do that, you will be able to reduce their anxiety. Reassurance, telling them this is a panic disorder, it will settle, nothing terrible is going to happen to them, because one of the core features of a panic disorder is the fear that something terrible is going to happen, or I'm going to die. Okay, so if you can reassure them that this is not going to happen, if they've had it before, say to them this is something that's happened before and it's going to settle. If they're in a specific area, try and get them out of that area. Say it's the inside of a mall and they're just having
fresh air.
Absolutely. So trying to get them out of that area may be helpful as well. And then, of course, if they are on medication, certain types of medication may be useful to use. Okay. But really trying to get them to focus, once again, in the here and now, to reassure them, to tell them they'll be okay. That's probably as much as you can do. And then, if necessary, we take them off to ER. But people often self-soothe, especially after the first one. Once they've been to casualty once, they can absolutely learn to self-soothe. And even though they get this anxiety, they are able to reassure themselves. They're able to say, this has happened before. I know it's panic disorder. I'm not having a heart attack. I will be fine. And eventually it settles down. Can I ask you, was this the first episode of panic that you...
No, I wasn't having a panic attack. I was someone.
Was that person?
No, it wasn't their first episode, but it's just you're standing there and you have to do something.
Yes.
I'm not just going to be staring at a person who's having a panic attack and you're like, okay, they're going to self-soothe. You have to do something.
You do have to do something. So it's really just reassuring that you're here for them, that you will help them. I think that's as much. I haven't actually seen that many people with panic disorder, actually, in terms of, actually having a panic attack. Okay, we know about it, all right, but if you, in terms of panic disorder, it's not something a psychiatrist, the actual panic attack, it's not something a psychiatrist will see often.
I'm not a professional, maybe, I don't know what else to call it. I mean, if it's not a panic attack, then what is it? When someone is just hyperventilating, crying, and they're just really...
overwhelmed and emotional.
Yes, but in a really extreme way. Like this, I've never seen that, so...
So that's... once again, we have to define things, we have to label them. It's not always that clear.
Yeah.
Okay. So, people get emotional outbursts, which are not necessarily panic attacks. This is an emotional outpouring of anger or distress or whatever it may be. It may not be, and it may be related to other factors going on in their lives, as opposed to a panic disorder, which a panic attack, strictly speaking, is if you see someone running in here with a knife, okay? We need to panicky because we either got to fight them or fight, right?
Yeah.
So you will get that adrenaline, rapid heart rate, body will be ready for that. That is a panic. That is, so there's a center in your brain, the amygdala, which will send out that fear, okay? That is, it doesn't have to be related to anything else. But then you get people who have emotional reactions because something terrible's happened, they've just had some bad news, etc. May lead to hyperventilation, but that is more an emotional reaction rather than a panic attack per se, but not always easy to differentiate.
Yeah, we were at a birthday party, and that just happened out of nowhere.
Yeah.
So there was nothing, out of the norm happening to cause that person to feel panicky or emotional or anything. But then the hyperventilating and the sweating and the just can't catch her breath, and then her fingers started contracting.
Okay.
So that was just
That's
a lot of
hyperventilating.
stuff.
So the finger contracting is because of carbon dioxide.
Okay, it's the
so build up.
hyperventilating.
So it's hyperventilating. So then they will cramp, and of course then that leads to further distress. Okay, so it's really, the main thing is if the hypervent is to regulate that breathing, which is actually just to say, slow down your breathing. That I've seen a few times actually in practice. Get them to slow down their breathing, inhale, hold their breath, and then slowly exhale and slow it right down to...
Box breathing, I think. Box breathing is what they call it.
Okay.
You inhale for 4 seconds, you hold it for 4 seconds.
Okay, well,
then
you taught me something because I have not heard of box breathing.
Welcome to well-being.
So there we are. So good.
Yeah. Okay, that was amazing. I mean, that was very insightful. Thank you so much, Dr. Simon. I think I learned a lot. I hope everybody listening to us learned a lot. So thank you for being with us today.
I hope they did, and thank you once again for having me, and it's been a pleasure.
My pleasure. In our next episode, we're talking about women empowerment, a topic that personally is very near and dear to my heart. Ladies, this one is for you, so make sure to tune in. We're available on YouTube, Spotify, Apple Podcast, and Anagami. Stay well and keep thriving.